Health Watch is presented by UMass Memorial Healthcare. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Healthcare. I'm Brittany Schaefer. Today's topic is painful periods.
While most women will experience some discomfort with their menstrual cycle, if you have pain that's prolonged or severe, that doesn't improve with taking over-the-counter NSAIDs like Motrin, if it prevents you from doing your normal daily activity like going to school or work, or if it's associated with things like painful bowel movements or pain when emptying your bladder, those are things you should contact your doctor for. When you see your doctor for an appointment for painful periods, you typically talk about your period, your cycle, how long they last for, how heavy they are, and what your symptoms are. If you've tried anything to relieve them over the counter and whether it works or not, and if anything tends to make that pain worse or better. You'll also have a physical exam where the doctor will try to identify if there's anything that they can feel in your pelvis, your uterus, tubes, and ovaries that may be causing the pain. Sometimes the evaluation also includes an ultrasound or some tests.
Are there conditions that make periods more painful for some women?
The medical terminology is called dysmenorrhea, and it can be broken down into two different kinds of dysmenorrhea, so either primary dysmenorrhea or secondary. Primary dysmenorrhea usually affects young women like adolescents, and there's no known specific cause other than just physiology. Whereas with secondary dysmenorrhea, that typically starts later in your mid to late 20s and may be associated with some cause like endometriosis, something called adenomyosis, uterine fibroids, and that can be evaluated by ultrasound or a physical exam and treated by the physician.
Are these conditions hereditary?
Although there's no hereditary known cause for primary dysmenorrhea or any associated risk factors, secondary dysmenorrhea, so uterine fibroids, endometriosis, and adeno, may be genetically linked.
Are there treatments to correct or lessen painful periods?
If you are having painful periods at home, if you've just recently started your menstrual cycle or you've noticed they've become more painful, taking over-the-counter Motrin, as long as you don't have any history of an ulcer or gastroenteritis, then you can take Motrin over the counter. If this doesn't relieve your pain, then you should talk to a doctor. We also recommend a good diet and exercise too. Exercise can really help release some of those inflammation toxins that you have during your cycle.
What are treatment options?
So the mainstay of treatment for primary dysmenorrhea is starting off with NSAIDs like Motrin, and your doctor may prescribe you a higher dose Motrin, as well as trying some contraceptive options. For secondary amenorrhea, the treatment options are very similar and typically start with NSAIDs or contraception. However, if this doesn't improve your symptoms, sometimes surgical intervention is necessary.